The COVID-19 vaccine and pregnancy. A new study has determined the Pfizer and Moderna vaccines are safe for pregnant women and even provide antibodies to newborns. But rampant misinformation and disinformation has spread online and may still be fueling distrust of the vaccine among some expectant moms. ABC's Erielle Reshef has this story.
San Antonio emergency room physician Dr. Nayeli Rodolfo-Zayas spent last summer working in the ICU, treating the most severe COVID-19 patients, too often watching them die from the insidious disease.
This year has changed my life completely.
At the height of quarantine, she found out she was expecting her second child. And like for so many pregnant women, the pandemic brought on an avalanche of added anxiety.
It just became a very difficult time for me. And at the same time, of course, I was pregnant and I wanted to be careful and protect myself and not catch the disease.
For Dr. Rodolfo, the weight of uncertainty compounding the already heightened emotions of pregnancy. And as she continued working on the front lines, she also feared for her own mother, a 57-year-old on dialysis. So when she got the call in June of 2020 that her mom had tested positive for the virus, her heart sank.
She called me and told me she was positive. I became really concerned. My mom had end-stage renal disease and she had liver disease and diabetes. So I knew that this could be pretty bad, and it was.
Did your mom know that you were pregnant?
Yes, my mom knew I was pregnant when she was sick, yes. I was trying to give her hope or give her something to hold on to so she could fight through, and I think it became clear that she was just getting sicker and sicker.
She watched as her mother's condition quickly deteriorated, and as she had done with her own patients, she stood at her mother's bedside as she passed away.
She was admitted and then passed away 4 days later in the ICU. I was the physician who pronounced her.
For Dr. Rodolfo, after nearly a year of loss and grief, she found a ray of hope in the form of the FDA-authorized COVID-19 vaccine. At 31 weeks pregnant, she got her first dose of the Pfizer vaccine in December.
I basically, was excited and happy and felt a sense of relief to get this vaccine. Of course, it was a bittersweet moment for me as well, because I was thinking about my mother. If she would have made it through, she would have gotten the vaccine and she would still be here.
But amid the vaccine rollout, misinformation and in some cases disinformation about the vaccine and pregnancy have spread online, fueling skepticism among some pregnant women.
There's nothing about these vaccines that make us concerned that they're going to cause problems either for the mother or the infant or the fetus. And in addition to that, I think that we also can say that now well over 40,000 pregnant women have been vaccinated, and we have not seen any safety signals in these women.
Dr. Laura Riley is the chief OBGYN at New York Presbyterian and Weill Cornell Medicine. She says the conversation with her pregnant patients about the vaccine is a delicate but essential one because pregnant women were excluded from early vaccine studies.
What do you say to those pregnant women who say, I'm just going to wait and see. I want more data before I get vaccinated?
I totally understand. I get it. The problem with waiting and seeing is that you increase the risk that you're going to get COVID while you're waiting. Pregnant women are at greater risk for severe outcomes due to COVID-19. And that means more likely to, need an ICU stay, more likely to need mechanical ventilation, and also an increased risk of death.
But now studies in pregnant women are underway, and months of experience with the vaccines gives leading experts confidence that they are safe for pregnant women and those planning to become pregnant. The American Society for Reproductive Medicine issuing a statement reading in part, "We stand by our recommendation that pregnant women and those seeking to become pregnant should be vaccinated." In February, Pfizer began clinical trials of its vaccine of 4,000 pregnant women. Pfizer's trial will be conducted in 44 study locations across the U.S. Participants will receive doses between their 5th and 8th month of pregnancy and will be studied for 7 to 10 months, even after they give birth. Idaho mother of 4, Ginger Bennett, volunteered to participate in the Pfizer trial. She spoke exclusively with ABC News before her second shot.
Hey, that's it.
So why
put yourself out there and join a trial of a new medication?
To my knowledge, I am the first pregnant woman in the state of Idaho doing this test. And I figure if I can show or tell something to these other women that are wondering, hey, what's going on for me? Then I want to show that to them.
Ginger is due in April with a baby girl and won't know if she received a placebo or the actual vaccine until then, but says she hopes that sharing her experience in the trial will help assuage some fears for other pregnant women.
I'm glad I get to be a part of this because I'm like, hey, I know there are other women out there in my place and they're just, maybe they're worried or maybe they just have questions. And seeing this, hopefully they'll say, hey, she's doing okay, or she's not worried about it. Maybe I shouldn't be worried about it either.
And while recent polls show vaccine hesitancy has declined overall as more doses are administered, Dr. Rodolfo says it was important to her to share her story for other Latinx women to see.
There's a lot of hesitancy and misinformation also floating around. So I was just trying to set an example for women and for Hispanic women in particular who are at higher risk.
In January, Dr. Rodolfo gave birth to a healthy baby boy named Benny, and she's since found out he has COVID-19 antibodies as a result of her vaccine.
Nayeli, what does it mean to you now to know that your newborn is protected with antibodies because of your decision to get vaccinated?
I am just grateful that he was able to get these antibodies and that once I go back to work and he has to go to daycare, he has that extra protection. So I'm very, very happy and very grateful that I made this decision.
For the mom of two, getting the shot was about more than protecting herself and her family.
Did you feel like you were honoring your mother by getting vaccinated?
My mother was a very caring individual and she always took care of herself and wanted to protect others. So I know she would have been on board with getting the vaccine. And in this way, I felt like I was honoring her.
What's your message to pregnant women right now when it comes to the COVID-19 vaccine?
I think given how serious COVID-19 could be in pregnancy and the fact that we're getting more and more safety data, I say get vaccinated, protect yourself, and, protect your baby.
Erielle Reshef, ABC News, New York.
Our thanks to Erielle for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.